Peace, mercy, and blessings of God be upon you all. Welcome, everyone. As I promised you before, every now and then, God willing, we will choose a case, a medical topic, or a repeated question from the closed groups of Pharma Academy, whether level 1, level 2, dermacosmetics, or even the tougher questions we get from our colleagues who are preparing to travel or completing the equivalency diploma with the great Chiro Flow team. Together, we will keep answering one important question at a time with quick, practical explanations. Today's case, a very common skin problem. Today we will talk about a case that is extremely common. Most pharmacists handle it correctly, but there's one small detail that many people overlook. This detail is the reason the condition keeps returning again and again. So let's focus, because today's question is very important. What is this condition? The condition we're discussing today is bacterial folliculitis. Bacterial means the cause is bacteria, most commonly staphylococcus aureus. Folliculitis comes from follicle, meaning an inflammation of the hair follicles. So the problem is simply bacterial infection of hair follicles. You might ask, is folliculitis always caused by bacteria? No. Folliculitis can also be caused by fungi, yeast irritation, or even viruses. Acne itself is considered a form of follicular inflammation. But today, we are talking only about the clear, classic bacterial type, because this is the one that keeps returning in many children. How does the case usually look? A child comes to the pharmacy. He has small, painful, pus-filled bumps on different parts of his body. The face, the scalp, the arms, the legs, or multiple areas at once. As you see in the example, this child has clear bacterial lesions on the leg, and infections may also appear on the scalp. The bumps are inflamed and filled with pus. If the condition is neglected, the infection becomes deeper. The bumps may become large, painful, and boil-like. This stage is called furunculosis. At that point, the child suffers from pain, severe itching, and strong inflammation. Why? Because the immune system is trying to kill the bacteria, and while doing so, it irritates the surrounding skin and nerves, causing intense itchiness. When the child scratches, the bumps break open and spread bacteria to other areas. In deeper cases, the infection can extend into skin tissues, leading to cellulitis, not eczema, but cellulitis, which means deep tissue inflammation. So now the story is clear, simple, and complete. Treatment steps, step by step. Now let's answer the important part. How do we treat it correctly? 1. Clean and disinfect the lesions. Start with normal saline, 10 to 20 milliliters, to gently clean the area. Do not touch the wounds with bare fingers. Then apply a disinfectant. Options include O-potassium permanganate, very light dilution, O-hydrogen peroxide, O-povidone iodine betadine. Important, do not leave disinfectants on the skin for more than 10 to 15 minutes, because they may cause tissue damage if left too long. With potassium permanganate, leave it 5 to 10 minutes, then rinse again with saline. 2. Apply topical antibiotic ointment. Use mupirocin ointment or fusidic acid ointment. Apply twice daily, morning and night. Remember, do not focus on brand names. Sell the concept, not the product. Any reliable, appropriate ointment is acceptable. 3. Give an antihistamine, because the child will experience intense itching, which can damage the skin and spread the infection. We give a child-safe antihistamine to reduce scratching, inflammation, and the risk of deeper infection, cellulitis. 4. Consider an oral antibiotic. If the lesions are widespread, the child has weak immunity or poor nutrition, or there are many pustules like the example shown, then we add an oral antibiotic. Cephalexin is commonly used and effective. Most pharmacists already know these steps and perform them well. So, where's the real problem? The real secret: proper patient counseling. This is the main point of today's video. This is the reason the condition keeps coming back. Let's discuss the essential counseling steps that must be explained to the child's mother clearly. Essential counseling points. 1. Personal hygiene. Advise the mother daily bathing with mild, fragrance-free soap. Avoid harsh or strongly perfumed soaps. Teacher, expensive brands are not necessary. What matters is suitability for sensitive skin. 2. Gentle drying. After bathing, gently pat the skin dry with a soft towel. Avoid rough rubbing, which irritates the skin and worsens the infection. 3. Clothing. Use 100% cotton clothes. Avoid synthetic fabrics that trap sweat and cause friction and inflammation. 4. Reduce diaper use when possible. For toddlers, prolonged moisture irritates the skin, making it easier for bacteria to penetrate into deeper tissues. 5. Keep the home environment moderately humid. Not too hot, not too cold. Heat increases sweating, and sweat aggravates folliculitis. But what if the problem keeps returning? This is the key question. Some children experience repeated bacterial folliculitis because the bacteria hide in certain places in the body known as reservoirs. These reservoirs repeatedly release bacteria onto the skin, even after you fully treat the visible lesions. Where are these reservoirs? Many areas can act as reservoirs, including under the knees, between the toes, skin folds, the groin, the perineal area. But 2 areas are the most important and the most overlooked. The 2 most important reservoirs. 1. The nose, anterior nasal area. Ask the mother, does a child scratch his nose often? Does he have repeated nasal congestion or irritation? Are there frequent small crusts around the nostrils? About 30% of recurrent folliculitis cases are due to staphylococcus aureus colonizing the inside of the nose. In this case, after completing the treatment, advise the mother to see an ENT doctor for proper nasal decolonization, often with mupirocin nasal ointment. 2. Dental problems. Check whether the child has dental cavities, broken teeth, retained roots, or gum infections. All of these are bacterial reservoirs. When the child takes antibiotics, the skin improves temporarily, but the bacteria remain in the teeth and quickly return to the skin. So refer the mother to a dentist for proper evaluation. Final advice. So, in summary, complete the treatment correctly. Give proper counseling. Explain to the mother why the problem keeps coming back. And always check the 2 major bacterial reservoirs, the nose and the teeth. These 2 points alone solve a large percentage of recurrent cases. That's it for today's short video. God willing, we will continue sharing simple, quick, and useful medical information. Good night. Hussein Lotfi.